Okay, and we are live. All right. Hi, everyone. Okay, we're doing live, okay, on both TikTok and also on YouTube. Hi, everyone. Good morning. Okay, I will be sitting over here. I think you'll be showing on. Hi, good morning, everyone. My name is. I'm a Singapore dentist with 20 years of clinical experience. Okay, and I'm from Singapore. Okay, if this is the first time you're seeing me, okay, you can put on and say hi, and I will hi back to you. And if you have any dental questions, let me know in the comments, and I would love to answer. I love to share with you more. All right, we're doing a simultaneous live on both TikTok and also on YouTube. Okay, let me know where you're watching from also, and the audience, and I'd love to chat with you all. Hi everyone. Hi. Okay, from TikTok. Okay, we have someone asking about unknown asking, can recommend any mouthwash? Okay, there's so many brands of mouthwash on the market. Is there any particular brand that is good? So many brands out there. Okay, just choose no particular brand. Okay, but the normal mouthwash. Mouthwash, I would say, two ways to clean our teeth. Okay, or teeth and gum. The first way, of course, is our mechanical method, which is brushing and flossing. So brushing and flossing more important. The second method will be our chemical method, which is mouthwash. I would say mouthwash is more adjunct. Okay, it's not a must. Okay. Usually, I will prescribe mouthwash when there's a gum infection. Of course, if you feel that you want a fresher breath, mouthwash is also a good idea. All right. Hi. Braces or invisible braces, which is better? Okay. Both have their values. Okay. We have invisible braces easier to take out. Okay. Let me. Invisible braces are easier to take out. This is the Invisalign. Okay, invisible braces. They can be snapped in, and they look very. It looks like there is nothing there. Okay, also it looks very aesthetics. Okay, whereas with the metal braces, you can still always see the brackets or so you can. What about white strips? Okay, white strips is a way to whiten teeth. That's the over the counter item that you can use. Okay, let me check my YouTube. Okay, it's the YouTube. Yeah, YouTube. Okay, good. YouTube is also on. Just making sure. And yeah, you can follow me on both. Okay, and any questions? Yeah, let's see. Okay, gum recession medicine. Okay, gum recession. Gum recession can be due to many factors. Okay, brushing too hard. Okay, can cause stress to the gum. Can also cause the gum to recede. Okay, so brush gently with a soft toothbrush. Not brushing well can also cause gum recession. Now, if you're not able to clean the area, the bacteria or the gums can be infected. Then over time, the gum will go down. Okay, gum go down, bone go down. Then we can have this thing called gum recession. Okay, if you look, this is a healthy tooth. Okay, a healthy tooth. Okay, if the gums are not ideal, the gums can go down, bone go down, gum go down. Then we have this is the bone itself. So the gums and bone can go down. Okay. Hi, my friends from YouTube and TikTok. Okay, let me know. Okay, if you have any questions. Okay, I would love to comment you or comment and maybe share a few more about any dental questions. Okay, Colgate Oxygen toothpaste, the red one, good or not? I won't know. Okay, so many toothpaste out there. For toothpaste, two things. Okay, number one, choose one with fluoride. Okay, fluoride helps to prevent tooth decay. And number two, okay, good to use a flavor that you like. Okay, these are the two main things. But of course, what else are we looking at here? If you have sensitive teeth, then of course, good to get the toothpaste for sensitivity. Like Colgate Sensitive Sensodyne, there's a lot of toothpaste for sensitive out there. Just choose the one that you like. Yes. All right. Okay. Good. Yeah. No. Okay. Thank you. Okay. Is it okay to brush your teeth after lunch? Okay. Hello, my Japanese friends. Okay, on YouTube. Okay. Hello. Good morning. All right. We're doing a simultaneous live on TikTok and also on YouTube. Okay. And if you're on either platform, okay, and thank you for being here. All right. And can't really speak Spanish, but Dora, I love Dora. Love watching Dora. Is it okay to brush after lunch? Brush is important. Okay, morning and night is actually good enough. Okay, brushing twice a day, morning and night is good. Okay, can you brush after lunch? Can, sure, if you want to. Okay, but more important thing to note, if you take anything acidic, okay, like lime or so, good to make sure that you either rinse with a fair bit of water so to dilute the acid, or maybe wait for a good half an hour before you brush, because the acid on can weaken the tooth enamel, and if you brush over a long period of time, that can also cause wear, or just a precaution that you can take. All right. Thank you. Hi, my friends on TikTok and YouTube. Okay, and good to see all of you here. Okay, and hi TC. Hi TC. Good morning, my friends from YouTube. Okay, and yeah, good. Uh, can hyperdontia fixed by Invisalign? Hyper means more. Okay, more teeth. Okay, uh, if you have extra teeth, okay, and that can result in crowding. Okay, so someone on TikTok was asking, can hyperdontia or cause be fixed by braces? Hyperdontia means extra teeth. Usually, for extra, when there's multiple or when there's extra teeth, that can cause crowding. This makes cleaning tougher. Aesthetic also, the smile aesthetic or might not be as ideal. Yes, braces can fix it. Invisible braces or traditional braces can fix it. Usually, if the extra tooth in a way, they might be looking at removing it. Then after that, looking at aligning the tooth. Hello, hi Cody Rose. Hi. Good morning. Hi, how are you? Yes, it's been a while since our last live. Okay, and hi. All right, good. Okay, Luke is asking. Luke from TikTok is asking. Hi, hi. Can I ask? Do what did Luke ask? Let me see. The comments are coming so fast. Can I ask? Most fresh grad from NUS break bond to work at QAM. Pros and cons on that. Okay, I don't like to use the word breaking bond. Okay, I would like to use the word buy themselves out. Okay, for myself, I also bought my bond out. So I was serving. Bond is actually 4 years. So for all my overseas friends in Singapore, dentistry is 4 years. It's a 4 years course. Okay, for all my overseas friends, dentistry is a 4 years course in Singapore. It's highly subsidized for Singaporean for sort of highly subsidized. So the government offer, then we are bonded because it's subsidized this 4 years. So we have to be bonded to the government for 4 years. So I actually work for about almost 2 years. Okay, so I came out to private practice much earlier. Okay, and yeah, is it a good idea? Never knows. Okay, I haven't done the other way. No, not coming out, but of course, coming out early, paying the money breaks, but you breaks the bank. Okay, but you get to start off with the stage that you want earlier. Okay, if private practice is what you want, then go for it. Is it the best? I won't know. Okay, I won't know what is the best for you. Okay, and yeah, you can make everything the best for you. Okay, even if you are in even if you're government practice, you can also make it the best. Okay, even if you're private practice, you can also make it the best. So yeah, you will know. Okay, just if you want to do it, if your hearts tell you that you want to do it, go and do it. All right, good. So anything is, yeah, anywhere, private practice or so. Okay, thank you very much for the gift. Okay, on TikTok, appreciate it. Oh, good. Thanks. Uh, Gayaman 21. Thanks for the gift. And my friends from YouTube, hi. Hi, Estrella. Hi, Angela. Good morning. Debedi, Vania Noons. Hi. Hello. Hi. If you have any dental questions, feel free to put the comments in the chats. Okay, I would love to answer your questions. Hi. Okay, Mr. Edwin Tong, is it? Okay. Yeah, Christian. Okay, I use Cura Stacks whitening toothpaste with carbamide peroxide and optic white. Yeah, for whitening, the key thing about teeth whitening is hydrogen peroxide or carbamide peroxide. So anything with this substance will help to improve your color. But of course, there's so many things out there in the market. Always good to also check with your dentist before starting any teeth whitening. It's no harm just bringing the whitening equipments to the dentist and let them have a look. All right. Yes, is it okay to miss a few brush days because of a long road trip? Okay, ideally, it would be good not to miss. Okay, have I missed before? Of course. Okay, we're all human. And yeah, there'll be some days that you miss. Okay, and instead of dismissing it, will be good to work on it. When I was on road trip, also when I was in camping in the army, when I was much younger, I do miss my brushing at times. Okay, but nowadays I don't. Okay, having all the necessary equipments. Okay, maybe just put a spare toothbrush, put a hotel toothbrush anywhere in the car or anywhere in the bag. Okay, and so that you will not miss brushing. I think that's always a good idea. Good to brush twice a day. Okay, everyone. Always good to brush 2 times a day and floss every night. Okay, then we can prevent any issues. Okay, and when you brush, always brush 3 rounds. Outside biting, inside then floss in between. Then we can all have good teeth for life. Okay, that's what I would like everyone to have also. Okay, thank you very much. And yes, okay. If you like what you're seeing here, and if you enjoy this session, okay, appreciate if you can give me a like on both TikTok and also on YouTube. Okay, and follow me on TikTok and also on YouTube. Subscribe me on yeah. I appreciate that also. Thank you very much for your support, and thank you. Appreciate that. And if you have any questions, okay, feel free to put on comments, and I would love to answer you. You have a fully grown wisdom tooth, UK Shah. You have a fully grown wisdom tooth, okay, but it doesn't hurt. Should I remove it? Okay, wisdom tooth is the third molar. Okay, our molar we have first molar. Okay, the first big tooth is the first molar. This is a premolar. This is a premolar. This is the first molar. Second molar. The wisdom tooth is the third molar. Third molar is a variable, or wisdom tooth is a variable. Sometimes it can be 1, 2. It can be 0. For some patients, it can be 0 wisdom tooth. It can be 1, 2, 3, or 4 wisdom tooth. So it's a variable. So if the wisdom tooth is coming out nicely, no pain, no foot trap, no issue, not bothering you, can you choose to monitor? Of course you can. Okay, if the wisdom tooth is coming out can't clean, foot trapping, infected, decay, then better good idea to have it removed. Okay, I hope that answers the question. So no, but always good to check with your dentist. Okay, they can also do a good clinical check. They can also take X-ray to have a look. Okay, usually X-ray is an OPG for overview look of your teeth, especially to look at the wisdom tooth. All right. Okay, welcome aboard. Okay, Gimme for following. All right, good. Okay, can I do ASMR? Okay, we have Petio YT asking me to do ASMR. Why not? I don't know whether. Let's talk about brushing teeth. I will whisper without a ASMR mic. There's no Blue Yeti here, but in the clinic it's quite quiet. So I'm going to do a ASMR brushing teeth to share how you can brush your teeth better. If you like what you are hearing, let me know. Okay, to brush our teeth, we want to brush 3 rounds. First round outside, second round biting, and the third round inside. Okay. Oops. The tooth came out. Sorry about that. Okay, so brushing, always brush 3 rounds outside from one end to the other end. Then the top teeth, always start from the end. Brush from one end to the other end. Second round is our biting surface. Okay, biting surface. The third round is the inside surface. Okay, I'm going to pick it up later. Okay, I think I need to get a new training sets. Good. That's the third round. Okay, inside surface. After the round, then we would like to floss the fourth round. Okay, Okay, I hope that helps. Okay. Oh, what do you want? ASMR of eating things, is it? Bubble gum. I don't have a bubble gum with me now. Yeah. Pick up the two that I drop. Oh my. Pick up the two that I drop. Oops. Okay. And you use what sinus? Okay, let's. We need to get new sets of tooth. They're all falling off. All right, we're all back. Okay, and we're all back. And yes, question. What question do we have? Was the ASMR good? No. You need a Blue Yeti mic, I guess. Okay, and you need to have the proper item. But anyway, okay, good. Okay, how can we stop receiving gum? Okay, pink healthy gums will not go down. Okay, however, if the gums are not ideal, if you don't brush well, gums can be sore. Sore gums can cause inflammation, can go down. So brush and floss well helps, and see your dentist regularly for cleaning helps also. Okay, I hope that's good sharing. If you like what you see, likes will be appreciated. Follow and will be appreciated also. Thank you very much for your support. Okay, and yes, okay. Your local C from YouTube is asking. Okay, guys, if you want to have your comments read, I'm trying to read the current comment on TikTok, but so many comments. Okay, on YouTube, you put the comments, I can read because there's not many comments. Okay, so yeah, you can still comment on both, either or is fine. But if you really want me to read, YouTube now is easy for me to read. I can read. You can go to YouTube, either or, both are okay. And yes, Dr. Tristan, hi Tristan Pei, can you do for your ASMR videos? Bubble yum. I've done bubble yum before. Actually, I got it from when I was in the States. Okay, I got bubble yum. Very nice. Strawberry flavor. Yeah, very nice. I love it. I love bubblegum. Okay. And yes, English or Spanish. I'm not gay. Okay. But it's okay to be gay. Gay means happy. I just got the comment from Jasminder Ra. The trend that is trending now. You don't move. Yeah, but it's okay. Being gay also means happy. And now we are in a very inclusive world. I think the whole world is changing. Okay, and which is a good thing. Okay, and yeah, I guess it's okay. Inclusive world now. All right, good. Okay, Jiang Guo Wong was asking on YouTube. Hi, doctor. Does root canal treatment? Does root canal causes health issue in the long run? Okay, root canal treatments means if the nerve of the tooth is not ideal, what they do is they will clean up the area inside. Okay, they will clean up the canal. You see, if the nerve is not ideal, there will be a swelling at the end. So what root canal treatments do is that they open up a small hole. Imagine this is a candle. If this candle is not ideal, okay, we can go in and clean the weak space. Once you clean the weak space, we put in a new wick. That's called root canal treatment. So instead of filling on the top area, we fill this space here. This is the canal. We fill this space. Once we fill this with a filling material, then the infection will clear with time. That's how root canal treatment. It's good if you want to keep the tooth. Okay. If we don't do root canal treatment, the infection can cause bigger infection. Then it can cause the loss of the tooth. So if you want to keep the tooth, then early root canal treatment would be better. Best is don't do root canal treatment. That's why brush twice a day, floss every night. Okay, and you don't need to do root canal treatment. That would be the best. Okay, and yeah. After root canal treatment, you will need a crown. So lesser will be great. Lesser will be great. Good. I hope I answer your question, guys. If you have any questions, let me know. Okay. Crema 2008. Hi, JL. Okay. What is the best way to whiten teeth? Scarecrow is asking. Okay. How do you treat TMJ peanuts? TMJ, I'm not the best person, but if your joint is hurting you, uh, usually in a dental clinic, I can get muscle relaxant for my patient. But if it's persisting, causing concern, then of course good to see a dentist who do good TMJ. That's from TikTok. Okay, we have peanuts from TikTok asking about the TMJ, and scarecrow. I'll do one at a time now. How to be fair? Or whiten teeth at home. Okay, brush and floss well. Will clean away all the surface stains. Okay, surface stains clean, make the teeth whiter. But however, if you clean, you do your best. The stains are not going away. Seeing a dentist for professional cleaning will be a good idea. What else can you do at home? Coffee, tea, wine, curry, anything that has more coloring would be good to take less. Then less chances of having stains. Okay, uh, and that's for scarecrow. And now we come back to this. How much does teeth whitening and filling per tooth? Have to check with your local dentist. Okay, for teeth whitening in my for general cleaning in my dental clinic, our fee is 160 for cleaning. Okay, fillings range from 180 to 250 in my dental clinic. Okay, and yes, okay, and Esther Ju, hi, good morning, my friend from TikTok. Okay, how are you? Okay, yes, I'm in Singapore. And uh, Desiree, okay, friends from YouTube. I'll answer one question at a time. Okay, but I'll try to. YouTube can read TikTok very fast. But thanks for the support, everyone from TikTok. Okay, thank you very much for all your kind comments and both TikTok and YouTube. Thank you very much. Okay, and yes, okay. Hi, Desiree. Hi, Charlene Chu is asking. Hi, Dr. Pei, from YouTube. Okay, I have two tooth that grow on my gum on both end of my mouth, upper and lower. They are cracked, and I realize my gums have been bleeding on and off. Even when I don't brush my teeth, should I extract? Okay, if your gums are bleeding, okay, usually a tooth broke or when the tooth give us issue, I have noticed a lot of patients usually, most people, normal reaction is don't touch it. Okay, what happens when you don't touch it? More things get trapped, they got more inflamed, more red. The right thing to do, of course, before seeing your dentist, the right thing to do, you can brush the area well, use a mouthwash, keep the area clean. Okay, if this area is hurting you, chew on the other side. If both sides is hurting you, really very difficult to chew. Okay, go for more softer diet. Of course, seeing a dentist to assess will be a good idea. If it's badly broken, okay, uh, then better to remove. If you can still do fillings, sure. Fillings always go for the more conservative approach first. Filling first, okay. Cleaning first. Clean well first. Okay, you clean well first. Dentist clean. Okay, if cannot, then of course filling. Okay, sometimes it's due to the gum, the discomfort. We mistaken it as the tooth crack. Sometimes there's a lot of things. Fillings first. Okay, if cannot, root canal treatment, crown. If really cannot, removal. Then followed by implant also. So that's what good to get them assessed. If it's hurting you, yeah, clean it well for now. Okay. Hi. Yes. Okay. I'm friends from TikTok is asking where am I in St. Andrew's Dental Surgeon in Tanjong Pagar. Okay, and yeah, that's where my clinic is. And Cherry is asking, can I ask your mom? Cherry on TikTok is asking, can I ask? My mom has loose gum teeth causing spaces. What should she do dental wise? If she have loose gum, okay, for patients with loose gum causing spaces, always treat the foundation first. If the gums are not ideal, brush well, floss well, then see a dentist for a professional cleaning. Or there's also this much that we can clean. Sometimes certain areas we can clean well, then of course get the dentist to do a good clean. A deep clean is needed. Then regular maintenance, so to maintain the gums. If the gums are not, you see, if the gums are okay, bones are okay, they will stay well. If the gums are not ideal, okay, the gums, or you see the bone and the bone and gum can recede. Okay, bone can go down, or gums can be inflamed, bones can go down, then can cause more movement. So how to get the teeth more firm? Brush well, floss well, clean away all the plaque or the tartars. Then that will help with the teeth and gum. Okay, I hope that helps. Yes, let's go back to YouTube. Okay, what happened if your tooth is almost loose? Okay, if your tooth is very shaky, then of course better to remove. We would love to save, but certain cases sometimes it's not ideal to save. It's not worth your time and effort. But if the tooth can save, always go with clean. Okay, do all the you clean well. Get your dentist to clean well for you. Okay, thanks for following me. Thanks for following me on TikTok, my friends. Okay, and thanks for subscribing to YouTube. Okay, thank you. Charlene, happy to share. Okay, my friends on YouTube. Thank you. Thanks for your question. Okay, appreciate all of your question. Okay, because you all ask question, that's why I can answer question. And yeah, it takes two hands to clap. Thank you very much, everyone. Okay, and yes, let's go. Okay, we go on TikTok. Okay, I am the biggest, but I don't know what's that question, but all right, good for you. How can I be a dentist in Singapore? The best way to ask is either Gemini or ChatGPT. Okay, AI is so good. You put in how do I be a dentist in Singapore? They come up with a lot of things. My information are backdated, but how I did it, uh, uh, JC for 2 years, junior college. Okay, of course, 4 years in secondary school, 2 years in JC. Then after I went army, 2.5 years. Then after that, dentistry for 4 years. Okay, subject combination. Back then it's triple science. Things has changed. Okay, ask AI, embrace change. Okay, learn new things. I'm still learning. I'm so amazed with AI and I'm playing with it almost every day. Now, with all this, you can just talk. You can talk and they will write everything down. So instead of typing, you can just put conversation and they can translate your voice into words. And after that, you can just ask AI, then they can actually reply you. Interestingly, awesome. Okay, so embrace AI, guys. Okay, YouTube, no one asking anything. Okay, so far, last comment is Charlene. Okay, yeah, thank you, Charlene. And yes, how can I whiten teeth? Okay, Harry's asking. Okay, how do I whiten teeth? So yes, guys, I'm on TikTok and YouTube. Okay, if you want to, you can also ask your question on YouTube. YouTube comments are the chats are slower. I can see everything, then you can reply everyone. Okay, and Harry is asking, how do I whiten teeth? We answer that. But yes, brush well, floss well, can clean with surface stains. And if you want to whiten teeth in a clinic, then of course go with cleaning first. Cleaning, remove surface stains. If that's good enough, good. Don't need to do teeth whitening. If after cleaning you remove the surface stains not good enough, then of course you can have professional teeth whitening or customized whitening tray. These are the two ways. Okay. Yes, friends from TikTok. If my two front teeth crack, what treatment to apply? Conservative treatment, always go with see a dentist first. Okay, very very slight chip. Okay, recontouring. Okay, recontouring to shape the tooth to look better. Always go for conservative approach first. Very very slight chip, leave alone. Okay, not bothering you, leave alone. Bothering is sharp, round off certain areas. Okay, bothering you some more bigger chip, then of course put fillings. Okay, fillings has constraints lah. Of course, then of course, if bigger chip, then crown. Crown is like helmet to cover the tooth to give it more strength. Good. I hope that answers your question. Okay, and yes, all right. Back to YouTube and then back to TikTok. Okay. If I see any questions on YouTube, then I will answer it. Okay, no question. YouTube. Okay, and yes, Henry. Do you now anything about braces? Braces. I don't really do braces. I have colleagues who are very good with braces. So braces help to improve your smile. Okay, and braces can improve function, so you can eat and chew better. Not so sure. Check with your local dentist. Okay, to see whether that's a good idea for you. Okay. Okay. Do I recommend gargling with hydrogen peroxide for whitening teeth? Okay, I recommend. Okay. I don't recommend using hydrogen peroxide just to whiten teeth, okay? But always good to check your local dentist, your dentist first, okay? If you want to use anything that contain hydrogen peroxide, or more for safety, more for peace of mind. Yeah, in Singapore, we can't really get any toothpaste with hydrogen peroxide. I guess the authority are concerned, and you can get it from Amazon though. I can ship. I got my hydrogen peroxide toothpaste optic white toothpaste from Amazon. Okay, Singapore you can't get it. But anyway, yeah, yeah. So any toothpaste, anything with hydrogen peroxide can whiten teeth. But on the safer side, always good to bring that along to your dentist. Let them have a good check on all your teeth first, making sure there's no active decay, the gum is good, everything is okay. Then before you start any thing that there's whitening or so, just more for on safe side. Whitening is mouthwash. Stephanie is asking, is mouthwash necessary? What would you recommend? Mouthwash, is it necessary? Um, Mouthwash, is it necessary? Sorry, mind blank for a moment. Okay. So two ways to clean our teeth: chemical and physical. Physical cleaning, the most important is our brushing and flossing. So that's the most important. Mouthwash is, I would say, still adjunct or optional. So you can do it, but not the most important. Okay, I have a friend, someone on the other side on TikTok. Okay, let's see. Okay, hello.
Hi.
Hi. Good morning. Hi, my name is
Do you want to
Tristan.
match?
And how do I address you? Sorry.
Chi.
Chi. Hi.
Kyle.
Hello.
Yeah. Cora.
Hi. How are you doing?
Good. Why
Yeah.
are you on TikTok, Doc?
Just doing a dental Q&A live. Okay, if you have any questions, that's I'll be happy to answer your questions if you have.
Number one, do
Yes.
calcium tablets work?
Ooh, calcium tablet. Calcium tablet works for calcium will be more for medical for the bones, is it?
Mm-hmm.
What the questions is calcium tablet to improve your dental health, is it? Or
Dental health? Mm-hmm.
I must say that I don't have much research, much evidence based on that area. But I guess these are supplement. It helps the bone, okay, and dental bone. It could help uh, a fair bit, okay. But if you're looking at something that's more direct, brushing, flossing has the most effect. Yeah, I would say.
Brushing and flossing.
Brushing twice a day, face, biting surface, inside surface, and also floss in between. Okay, having a good system. Okay, always brush from one end to the other. Okay, always brush from one end to the other. Because most of the time, I realize that for a lot of patients, is sometimes when we brush in the center, we might be stopping here. Always good to brush from one end. So physical cleaning like brushing and flossing can do a lot more wonders for everyone. Yeah, I mean, calcium. If calcium is something that like for as a supplement, why not? It's perfectly fine, and that's also good to go.
Okay, let's match. Do you
Alright.
have any people who send you gifts?
Yeah. I have. Okay, but yeah. Okay. But not many. Yeah. Oh, you're
It's
looking for a
okay.
match. Okay. Sorry. Yeah. Anyway, I'm going off soon already. But thank you very much. Okay. Yeah.
Okay, you don't want to match?
I'm not. Yeah, because I'm going off soon and going to see my patient soon already. Sorry about that.
Alright.
Yeah. Thank you
Where
very
are you
much.
from? What country are you in?
I'm from Singapore. Okay. Yeah.
Singapore.
I'm from Singapore.
Alrighty.
What about you? Where are you from?
Nigeria.
Nigeria. Awesome. Okay. Stay well, stay good. Okay.
Stay good.
We'll see you
Bye.
again. All right. Bye bye. All right. That's nice. Okay. Good. Yeah, I sound nervous. Maybe I don't do this so often. Okay. Yeah. Maybe. Yeah. All right. Okay, Kyra. Hi. Okay, everyone. Thanks for being here. Okay, I really got to go. Okay, got to prepare for my patients. Okay. Uh, in my clinic. Okay. Thank you. Okay, I'll see you again real soon. All right. Bye. Bye. Bye, guys. Bye. Bye.